My name's Annette, and I am 2 weeks and 1 day out from PTE surgery today. I thought I might put a video on YouTube that would help others who were considering having the same surgery. I want to give you some background on myself, and I guess I'll go chronologically because it'll give you an idea of kind of what got me to where I ended up. This is 2016 July. Back in September of '09, I was diagnosed with breast cancer. I had a lumpectomy, and then we started chemo in November of '09, and I finished up all my chemo and my radiation in May of '10. As soon as I could, I started riding my bike to try to work myself up from the chemo. And I got a little better for a while, and then all at once it seemed like I just was, if anything, I was getting worse, not better. I just couldn't breathe. And finally, well, I guess actually, first of all, I think it was in the fall after chemo and radiation, I was riding my bike, and all at once my leg was just killing me. And I was all the way across town, very small town, but still. I thought, I don't know if I'm going to be able to make it home. And so I went over to a curb and I just waited until the pain subsided enough that I could get back home. And I guess I'm an idiot. I should have thought of a blood clot, but I didn't. I was taken to tamoxifen, which is known to cause blood clots, but at any rate, I didn't think of that. So I kept riding my bike, and in February of 2011, I went to the doctor because I thought I had strep throat. My throat hurt so bad from gasping air. And she said, "You don't have strep." And I thought, well, I have strep. I don't care what you say. At any rate, she put me in the hospital, and I had blood clots in both lungs. I'm trying to remember. So I was in the hospital about a week then, and they did the shots in the stomach, to get my blood levels where they should be, and they put me on Coumadin, and I went on my merry way. So that was 5 years ago. In the interim, they took me off the Coumadin at some point, and then, I just kept saying, I can't breathe. I just can't breathe. And so she put me back on Coumadin at some point. And I'd been on it ever since, probably at least 2 years here before the surgery, if not longer, and probably longer. At any rate, I eventually got sent to a pulmonologist in Lincoln. We live in Nebraska. And he told me that some people are eligible for this surgery and some aren't. And I remember thinking to myself, well, I hope I'm not one of them, because I'm just so scared of anything like that. I was one of them. And so he, right off the bat, got on the wagon to get me to San Diego to have the surgery. I didn't have to go to San Diego, but they're the best, in my opinion. It's just my opinion. They've done, I was number 3508, so that's how many PTEs they've done up to me, and they do them every single day. They have the most experience of anybody. It's University of California, San Diego is where it is, and the hospital itself is in La Jolla. Well, that was a year ago, and I remember when we left that meeting with the doctor thinking, I just felt light as a feather, because I thought there's no way I'm going to go have that surgery. And so for a year I went on Ambien. Not Ambien, Adempas. I don't even know what Ambien is. I don't know where that came from. But I went on Adempas, and you have to kind of work your way up with that because it's pretty potent. And it's supposed to help expand your blood vessels and make it easier for you to breathe. In my case, it did help me breathe. I mean, it wasn't like I was back to normal, but I think it helped. What it didn't help was to reduce the pressures. The pressures, that's what my pulmonologist always says. So I guess that's the pressures in my chest that are a result of my lungs having to work too hard. And, well, anyway. I went a year on the Olympus and couldn't see a significant improvement. And in fact, he told me he didn't see really any improvement in my pressures. And I remember the last appointment I had with him, which was probably in March. Well, they put me on Lateris too, which had exactly the opposite effect on me of what it's supposed to have. I could not breathe, I couldn't sleep, nothing. I tried that drug 2 or 3 times. And so I was on Lateris when I went in there, and I knew everything was going to look worse because of it, and it did. And at any rate, I was all ready to tell him how far I'd been walking and everything I'd been trying to do. And I could tell, as soon as I walked in that room, he was not listening to me one iota. He had his mind made up. I was going to go get that surgery. And the first thing he says is, "We've got to get you to San Diego. Your window is closing on this surgery." Well, I didn't even know I had a window. But at any rate, I felt like it was impossible. My dad was sick last year. He died in August. I did back-to-back trips up until that time, and 2 months after Daddy died in August, we brought my mom up here, and she lives just 2 blocks north of us. She is 100% dependent on me. She can't write her own checks, she can't clean her house, she can't drive, she can't do errands, she can't think. She needs me every single day. And I thought, there's no way I can do this. Well, somewhere along the line in here I saw a quote that said, everything's impossible until it's done. And so I just tried to keep thinking about that, and my husband got on the stick and enlisted all of our brothers and sisters-in-law to help us with our dogs. We have 4 dogs. They all stayed here. They traded off staying at our house. The dogs, I don't even think the dogs hardly missed us. They did such a good job. My mother-in-law visited my mom every single day. She brought her ice cream, made her meals, just you name it, she did everything. My nieces and sister-in-law and brother visited mom and helped her. I hired on a home health lady, Jeannie, who is just the best and went every single day to make sure that mom stays on her pills correctly, because she takes big time pain pills. And so on June 6th, we flew to San Diego. That alone was a nightmare for me because I don't fly. I got sick 3 times on the plane. But we got there, and we checked into the Days Inn motel in Hotel Circle South, if you're familiar with San Diego, which we aren't. The first week that you're there is all for tests. And so I have the schedule in front of me, so you kind of know what will be in store for you if you go to UCSD. First of all, they'll stop your Coumadin before you even get there, and then they're going to give you those Lovenox shots, maybe heparin, but I think Lovenox are easier and less painful, that you got to give yourself in the stomach, and that's not bad. Don't worry about it. Me, I got plenty of fat there, so no problem. The first day you go, you'll go over, there are 2 hospitals right next to each other. One of them is the Thornton, and one of them is Sulpizio. Your surgery is actually over in Sulpizio Cardiovascular Center. But when you check in, you're going to go to Thornton. And like I said, they're right next to each other. So you go in, let's see here. First thing off, somebody from the PTE staff is going to meet you, and just talking to them, in our case we got to talk to Ulysses, and I know Olga is another one, and there's probably more. but it helped so much just talking to him. He helped us with, you know, taxis and shuttles and stuff like that that we didn't know anything about. So you'll talk to him. Let's see. You go to the Perlman lab for blood work and urinalysis. I don't remember peeing in a cup, so I think it was just blood work. Then on the same day, you have to, well, you do a chest x-ray, and you got to do that test where you breathe in the mask. Maybe it doesn't bother you, and I hope you're one of them who it doesn't. It bothers me immensely. They did let me hold the mask myself, and I only had to go 2 minutes, not 3. I really thought it would have helped a lot if the person in the room would have just stayed in sight. And if there was a clock that I could watch, or if they would count down for me. But at any rate, I made it through. That's the first day. Okay, now let's see. On the second day, you do an echo. And then you'll have time for lunch probably or something. And then you visit with the pulmonary vascular team. And they'll talk to you about your tests thus far. On, let's see, third day, you will have a right heart cath. I should say, and I assume the schedule is similar for all of us. A pulmonary angiogram, which is all done at the same time, I guess, if required, coronary angiogram. They do the thing through the neck, not the groin. There's an optional meet and greet with other PTE patients every Thursday. Am I right? Yeah, I think that's right. We didn't go to the first one because I was pooped. Then on Friday, let's see, that's the 4th day. You go back and they put in this IVC filter. I don't even know where it is, down here somewhere. But that's put in to block potential clots from your legs going to your lungs. And I don't think they do that for everybody. So you may not have to do it, but it's the same procedure where they go through the neck, you know. And I remember after that procedure, I was so tired. I didn't care if I got off of that table. And we went back to the motel, and I proceeded to start coughing and coughing and coughing and coughing. And so as I look back on it, I think I was sick. I never know I'm sick while I am. It hits me afterwards. But at any rate, when we then met with the surgeon on the next Tuesday, so our last test was a Friday, we met with the surgeon on Tuesday night for scheduled surgery on Wednesday. Well, they noticed that I was coughing, so I had to put off my surgery for a week and a day. So we holed up in the hospital for that long. You get to skip that part. You would have gone to surgery the very next day. Okay, so here we are. We have our surgery. In my case, they woke me up. Well, first of all, my surgery took a little over 9 hours. I call it dead. They call it suspended animation, clinically dead, whatever. I call it dead. That part of, for me, was 95 minutes. They never have you in that condition more than 20 minutes at a time, so you don't have to worry about brain damage. I'm just as brain damaged now as I was before, no more, no less. So don't worry about that. I was kind of worried about that. In my case, I'll try to show you some pictures at the end of this video because I'm not very good. I don't even know what I'm doing here, so I'm not good enough to do it all at once. In my case, they cleaned out clots from both sides of the lungs, 10 on one side, 11 on the other. Mine were particularly hard to get to because of where they were located. But they said also, when that's the case, oftentimes the patient shows the most improvement. And I think I did. The morning after surgery at around 9:30, they started waking me up. When they wake you up, You're going to have that breathing tube down your throat. You're going to have 3 chest tubes, which, as far as I'm concerned, as long as I have a breathing tube, I don't care what else is. Just get that out. In my case, it took about an hour and a half waiting around to get that tube out. I don't remember it coming out. I remember waiting to get it out. It will get out. Don't worry, you can make it. I'm just worse than normal about things like that, and I made it, so you will too. That tube comes out, thank God, and then you're pretty much, you're in pain, but it's not awful. It's not as bad as I was thinking it was going to be. In my case, the other bad thing about me is I cannot tolerate pain meds or anesthesia. So I had to pretty much go with just Tylenol. Now, twice they tried tramadol with an anti-nausea med, but I was still sick. So I just had to use Tylenol, and I made it. No problem. I mean, well, it wasn't fun, but I made it. Because I was so sick from the anesthesia, the first 3 days, I either laid in bed or sat in my chair with my head completely still, with my eyes shut, and that's it. I didn't move my head, nothing. I couldn't open my eyes. If I did, everything on the wall in front of me was just scrolling, scrolling, scrolling. I was so dizzy. Day 4 and 5, you're going to start feeling a lot better. Once they get those chest tubes out, that helps a lot with the pain. I didn't know that, but somebody said it, and it's true, I think. As far as the pain goes, your incision is painful, but in my case, the most pain I had was across here and across the upper back, and especially right here. So, you know, you got to get comfortable when you're laying down and everything. And of course, you can't put much pressure on anything, but you'll get through it, no problem. We're 2 weeks and a day out right now, and you know, if I stretch my neck, I can feel that there. I feel like my posture's really bad. My range of motion has improved a lot. Just in that 2 weeks, see, I can turn my head. Before, it was kind of like, don't turn your head too far. When you wake up, so you've got the breathing tube, there's 3 chest tubes, got this IV sticking out of your neck, and one here. Or not, probably not sticking out, but anyway, it's there. And I think that's it. I was really dreading the chest tubes, but when they got to that point, and that might have been on day 4, Heather, my nurse, let me hold her hand, and then Dr. Fernandez, or Fernando, I think, sorry, I hope I said his name right. He came in, and he said, look at me. And I did. And he said, take a deep breath, purse your lips, which I did. And I looked at him the whole time. And he pulled them out. Right when I was getting ready to say, oh, this is going to hurt, or thinking that, it was done. So it's more of a just uncomfortable. You know, you just want it to be done, and it's over in a matter of 1 or 2 seconds. So don't worry about that. I forgot to tell you, the other thing that you'll have when you get out of surgery is, I forget what they call it, but it's a wide kind of feels heavy, I don't know if it really is, but bluish purple thing shaped like this that is covering your incision, so it goes down about to the bottom of your breastbone. And that's taped on there, and then it also has a thing that's suctioning that all the time to keep it down tight. I thought it was a wound vac until I realized there was nothing coming out of there. So that, I think, in my case, came off the day before I left. And then when they take that off, you'll be left, they put on these steri strips. So those, in my case, went on last Friday. Today's Thursday. So tomorrow, she said, I don't want them on there for more than a week. So if they're still on there, go ahead and take them off. Mine are all still on there, so I'll take those off tomorrow, which will be a week from when they put them on. So I just wanted to tell you that too. Thanks, bye. By then, I think you're probably to day 4 or 5 and you're feeling a lot better anyway. I was ready to go to a regular room, I think, on day 3, but there wasn't one available, so I ended up waiting, I think, a couple of days to get in my regular room. I was in the hospital, let me think. Surgery was on 6/23. I was discharged on July 2nd, Daddy's birthday, and he would have been 91. Let's see. I wanted to just quickly tell you a little bit of what the information packet will have for you that you get from UCSD. One thing, of course, is your schedule, and they have phone numbers and prices for taxis that you can look at. They have a list of motels that you can get a cheaper rate with because they're associated or somehow connected with UCSD, and you get a cheaper rate. We stayed at Days Inn the first 2 weeks, I guess, which is 12 to 14 miles from the hospital. But what you can do, if you're able to walk it, you can. It's not that far to get to the UCSD shuttle at Hillcrest. Once you get to that shuttle, you ride it all the way over to the hospital where you're going, and there's even what kind of a golf cart thing that will take you from where they drop you off to the hospital, but we just walked that. Now, on the other end, getting on the shuttle from the motel, we got a taxi because Bailey said he thought it would be too hard for me to walk. So you'll have that information. Let's see what else. They give you, in case people want to send you cards or something, they give you the address where people can send those for you. There's directions to the hospital from various places that you might come in. There's the discounted travel accommodations I was telling you about. The UCSD has the Bannister House, and I'm not sure about this, but I think they maybe try to schedule it such that when you're actually in there for surgery now, not tests, but surgery, they get you in there as soon as they can. We were so thankful. We got to stay at the Mesa Apartments, which are right over there by the hospital. Bailey could walk out on the sidewalk and see my room because I was on the 4th floor, penthouse, best room. See if you can get that one, 420. He could look out at night and see the lights on in my hospital room. So nice, 2 bedrooms, a little kitchen, living room, patio, hummingbirds, little lizards. I mean, it was just, to walk into that place when I got done, I can't even describe how good it felt. Everything was decorated so cute, and even the soap was antibacterial, but it was spring green, not hospital orange. So I just appreciated that so much. And the rates are less than the cheapest motel you could possibly find. Now, as I understand it, they have another, well, I guess the main Bannister House is over maybe in the Hillcrest area. Let me think. Yeah. It's close to where you get on the shuttle at Hillcrest. And so I'm sure that one is really nice too. That's just not where we stayed. Okay, so I don't want to just gab forever here. There's more driving directions. They give you information in case maybe you need some help with your plane tickets. We didn't do that. I just got Southwest, the kind that you can change, and I did have to change them. You get a PTE teaching book. It tells you about the housing options, transportation. That's my stuff from work. Let's see. There's a planning tool that you have to turn in, and it'll ask you things like, will your insurance cover it? Well, obviously, you probably wouldn't be there if it wouldn't. You know, how are you going to get there? Do you have your own oxygen? All of that, those things. When I left, I don't have to take a Dempus. and I'm even not on oxygen. Of course, the oxygen levels are a lot better in San Diego than they are in Nebraska because of the humidity. But I did not even have to have oxygen, and they told me that only about 20% of the people go home without it. But even if you do have it, it'll get better. And that is the one thing that I remember my surgeon, who was Dr. Pretorius, and I tried to look up about him, and I saw that he's practiced in South Africa, and so I'm thinking that might be where his accent comes from. But after it was all over, he came in, and he was kind of sitting, he kind of sits on the counters. And everybody else had just been bustling in and out, and I didn't feel like I should interrupt anybody to ask questions, you know. I'm terminally polite. But he was sitting there looking at me, and he says, "It will get better," kind of like Arnold Schwarzenegger would say, and I keep remembering that. It will get better. And you will too if you go for surgery. And I wish you the very best of luck. Thanks.